Adapting class, and thank you for deciding to watch this video. I would say if you click on this video and you're watching it, congratulations to you for taking the next step in your nursing career. You make the correct choice. Of course, tackling NCLEX questions can feel overwhelming. That's why you click on this video. In this video, I will break down how to answer NCLEX questions correctly. Select one efficiently. Before that, if you don't know me, I'm Adapting Class. It's a channel where we master NCLEX content and test taking strategy. This is the strategy. Simple. I number them to like 15. But look at it. The key things I do if I answer questions, I do it the same thing. Number one, do not overanalyze the question. The question is being tested and they know they've tried these questions. There should be no ambiguity in the question. And so if you overanalyze it, you lose the point. Treat every question like it is straight out of the textbook. This is what it was written. They're not going to take any weird, esoteric information. Straightforward, simple language. Avoid bringing your experience outside assumption. Don't assume anything. Don't add extra information to the question. Whatever is in the question, deal with it. Even if it's a case form, stick with it. Whatever they've given you, don't add symptoms, don't subtract symptoms. Focus on the question as it's written and analyze it. If you do that, you'll be golden. You don't think about anything. If the question is 3 lines, focus on that 3 lines and answer it. Number 2, take your time. There's no rush. You don't have to answer all the questions they give you. So far as you answer enough to pass. You don't need to answer all 150 questions. The minimum you can answer is 85. So if you can spend the whole 5 hours to answer 85 questions, it's still good. You take your time and treat each question as your last question. Each question deserves your full attention, 100%. Remember, the wrong answers are your enemy. The more you answer wrong answers, the more likely you're going to get more questions. And time is your friend. So time is your friend. The wrong answer is your enemy. Focus on one question, one at a time, and avoid rushing. You don't need to rush. Relax. If you're rushing, take a break and come back and deal with the question. But every question is important. Every question is important. If you answer more questions correctly, the computer will give you less questions and it will shut down. That is the key for passing the NCLEX. Number 3, pay attention to how the question is written. Every question is broken down. There is a question being asked, there's a case, there's a keywords, I call them buzzwords and phrases, and they part of the stem of the question. So pay attention. And when you pick your answers, avoid answers that contain absolute, like never, always, must. They are often wrong. But pay attention to the buzzwords. If you're unsure, look for umbrella answer. Umbrella answer is the one that contains everything. It's all generalized. It's not fixed. It's not specific. This is an option that encompasses element of the question and even element of other answers. You take the question and then you take other answers and put in one. It's more comprehensive choice. And that is the easy way if you have to guess. Just because you don't understand it, that doesn't mean it's wrong. Don't pick the one that makes you feel comfortable. If it's comprehensive, most likely it's the right answer. Number 5, if you notice answers that are saying the same thing, they are incorrect. You can't have answers saying the same thing. On the other hand, if they say opposite things, most likely one of them is right. And you pay attention to those 2 information and see which one is answering the question. Number 6, for select or apply, I think you don't even have to worry. They give you 10 answer choice. Pick those you're confident. Select those you completely 100%, 101, 110. Don't over-select. Don't select too much because you think if you select all the 10, you get all of them right. Well, maybe 5 is right, 5 is wrong, then you get 0. They do something they call plus minus scoring. So pick those you know you are 100% sure and get your point and walk away. If they give you 6 options, you don't need to get all the 6. If you get 4, it's good. Take it and run away. If you pick 6, you lose 2, you get 2 answers. So don't do that. And for case study, I say buzzword. If you want to know how to answer case study, check Adapt class. Go to my YouTube site and check out answer. The first 3 sentences is your key. You'll be able to diagnose the problem without any issue. When it comes to priority, you know what I'm going to say. You got to be sharp. You just have 1 second. Who will you give that 1 second to? No, everybody need that second. Everybody is a priority. When they come to the emergency room, they think they are priority. You got to deal with them. But you are the nurse, entry-level nurse. You have 1 second. Who do you want to give it to? Classify them. And when you classify, pay attention to the breathing problem, electrolyte, shock, sepsis, airway, and pain. And when you deal with the pain, deal with the pain that is going to lose your life, limb, and eyesight. If you want more, check out that 10 class. The game changer is how the question is rating. Read the question from the back so that you know what the examiner wants you to do. Then find the case. The case is the first sentences of the question. That's the stem. Within those stems, there will be a buzzword that will tell you what the question is all about. A change in patient condition, a new information, and medication. Rewrite the question and take ownership as if you're taking care of this patient. If this patient has so and so, what would I do? But if you keep on reading the question the way it's written, it's very confusing. And before you do, after you generate your own question, come out with your answer. If you know answer you're looking for, the answer choice will pop up like a candy, like I always say. And number 9, expect to go through up to like 150 questions. Don't go there and say, hey, 180, 85, I'm done. No, you may go all the way. So stamina is the key. And if you start seeing similar questions, the computer is identify areas you need to improve. It has detected your weakness, and don't let him poke on your weakness. Careful on how you select the same kind of question. They keep on asking you. They try to trap you. Make sure you understand the question well because they've detected your weakness. If they detect your weakness, they're going to dig deeper and deeper and deeper. Stay focused. Be calm. It is part of the process. Don't panic. Don't overguess yourself. Make sure you're answering what is being asked. Number 10. I tell people all the time, if you're going to take the NCLEX, as soon as the test begin, the first 20 questions is your key, it's your brother, it's your sister, it's your life. Pay attention and take your time. Don't rush the first 20. Every question is key. Take your time. Aim at answering most of them correctly. And when you do that, you stay above the passing level. Remember, as you answer 20 questions in a row that are right, or 15 questions in a row that are right, they are correct, the next questions get harder and harder. But don't panic. If you mix the other question, the computer will say, let me bring you back to your level that you can answer. If you answer it, it goes up again. So you keep on going up and down, up and down. You want to do that. Answer hard question, you mix it wrong. They give you better question that you can answer. They give you hard question, and as soon as you keep on going seesaw like that, you will pass, and the computer will know that you have definitely done your job. Take breaks every time it's a question. And definitely when you get to the 80 mark, before you get to the 85, that 5 questions is your key. Keep on answering as if it's your last question and pay attention. Take break at the 80 mark and come back and do the 81, 82, 83, 85. Of course, if you answer 85 and the computer give you another question, 80 says, take a deep breath, relax, remind yourself, I'm still in the game, I've not failed yet. Giving me questions after 85 means, well, I'm doing okay, I've not failed. And that means you need to stay focused, be determined, don't lose your strategy, don't throw all the strategy that you've been doing, don't throw it away. It means you're doing something good and stick with it. Keep on sticking one question at a time. Take breaks and stay focused. Look, preparation is the key. Make sure you're practicing questions every day. Have a mixed kind of question, whatever Q bank you're going to use. But the most important thing is don't memorize the question. The way the question is written is the concept. If you know the concept, you can answer any question. I see people writing every rationale for every question. It's not going to help you. The key is the concept behind the question. If you figure out the concept behind the question, you don't need a two-page explanation of the question. You just need that two concept. And if you know the two concept, you use it to answer any question you see it again. So when you're reading rationale, just focus on the concept. Identify your weakness area and focus on it. You don't want to go to the test that you don't know anything about infectious control. You want to focus on it, but don't focus on the other ones. The questions are adaptive, right? So you still have to know a lot of things. You still have to know most of the subjects, but make sure you are not completely weak in one area that when the computer give you a question and that you can answer it. Your preparation is to booster yourself to be confident in all and be comfortable. Don't say, I hate pharmacology. Therefore, you see a question in pharmacology, you're already defeated. No, that's not the point. Don't forget to take care of yourself during this journey. It's hard. Get plenty of sleep, eat some good nutrition, stay hydrated, clear your mind, be healthy in your body, and then you'll be able to focus on your exams. And the last one, finally, keep a positive mindset. I always say mindset is always the key. That's the attitude. You being sharp. Remind yourself you have started this journey and visualize your sources. You have got what it takes to become a nurse. Don't let anybody tell you otherwise. So stay focused. Go back to the drawing board and try and keep on doing what you can do best. Remember, you are prepared for this moment. Trust your knowledge. Use those strategies. Take it one question at a time. Don't overselect. Don't overguess. If you need help, subscribe for more NCLEX tips and let me know what you think. Put down your comment in the comment area. And good luck, future nurses. You got this. And Dr. NCLEX got your back. Take care of yourself. Bye.